I'm Dr. Cassia Vetfolio and host of Vet2Vet. Today we're going to be talking about hyperthyroidism in cats, which can be a little bit of a tricky diagnosis. Feline hyperthyroidism can really play a game of hide and seek with us, hiding in cats we may never expect. Joining me is Dr. Daniel Langlois, Associate Professor of Small Animal Clinical Sciences at Michigan State University College of Veterinary Medicine. Hello, Dr. Langlois. Thank you for joining me.
Hey, thanks a lot for having me. I really appreciate it. I'm always happy to talk about endocrine disorders in dogs and cats. So again, I appreciate it.
We're so thrilled to have you. So kind of jumping right in, I know hyperthyroidism is often relatively easily diagnosed by general practitioners, but some cases can, of course, be a bit more challenging. What kind of cases are you finding where you're being consulted by general practitioners, where they may be struggling because the lab results aren't agreeing with the clinical signs or for some other reason?
Yeah, exactly. As you mentioned, I think most of the cases of hyperthyroidism that we see are usually pretty easily diagnosed, but we do see the cases where the clinical picture and the thyroid hormone results don't always align. And I have a couple of examples I'm happy to show, and I do think we see a fair number of these cases. And the first kitty was a cat named Agnes that we saw. It was quite some time ago now, but she was a 13-year-old female spayed domestic short hair that actually we saw her after several evaluations at her veterinarian, but she had been going to her veterinarian yearly for wellness exams, and she had reportedly been healthy the entire time. However, at her most recent visit, they had noticed that she had a very, very small possible thyroid slip on the left side of her neck. And as part of her geriatric wellness exam, they included a total T4 measurement in it. And as you can see, her total T4 concentration was at the very high end of the reference interval. In our case, our reference interval goes up to 46. Her total T4 was 45. So a little bit concerning in this otherwise presumably healthy cat. The other case I have is a little bit different. And Nigel is an 11-year-old male neutered domestic short hair. And he had pretty pronounced clinical signs. He had been losing weight for the past 3 to 4 months. In fact, it was pretty dramatic. He went from 10 pounds all the way down to 7 pounds. In addition, he had been having some vomiting and diarrhea during that time. His appetite had even dropped off during some of these events as well. And on physical exam, he was definitely a very thin cat. And on his biochemical evaluation, his albumin was a little bit low, his cholesterol was a little low, and his total T4 concentration was very mildly increased at 56 nanomoles per liter. So again, two cases, two very different scenarios, but both of them having total T4 measurements that are sort of right near that upper end of the reference interval.
Absolutely. And two completely different presentations. How often are you seeing these types of cases, both in terms of the lab work not matching the clinical signs, and then also just hyperthyroidism in general? Is our prevalence of hyperthyroidism increasing in recent years?
Yeah, great question. And so there are some studies that suggest the prevalence has actually increased over probably the past 30 to 40 years. Now, whether it's really changed in the last 10 years, maybe not, but what I do think that we are doing is we're catching a lot of cases earlier in the course of disease. We're screening a lot more animals for hyperthyroidism. There's a lot more cats that have annual wellness exams where a total T4 measurement is part of their geriatric chemistry profile as well. And what I have on this table right here is the results from two studies. One was done in 1983, one was done in 1993. And they're basically showing the frequency of clinical signs of hyperthyroidism. And you can see that in the study in 1993, most of the clinical signs are being reported less frequently. Not that the disease pathogenesis has changed, but again, I think it's reflective of the fact that we're probably catching some of these animals earlier before all of the classic abnormalities have developed. And this is an image of two cats that I treated at our hospital at Michigan State. Both of these cats were diagnosed with hyperthyroidism. And as you can tell by looking at them, neither of them looked like the classic hyperthyroid kitty. Orion was around 13 pounds at the time of diagnosis, and Middens, although not at his biggest, at the time of his diagnosis, he was actually 27 pounds. And so again, certainly not the classic hyperthyroid cat, but both of these were cases in which the owner had complained of weight loss. And so again, I think we're catching a lot of these cases earlier in the disease course.
Sure, just making sure that we're staying on top of that annual blood work and watching those trends. I know that's one thing I've seen in the blood work, running it year after year is it's just climbing a little bit more than you'd like it to, but 27 pounds. I don't know that I've ever suspected hyperthyroidism in a 27-pound cat.
Completely agree. We were a little bit shocked ourselves, but at the end of the day, he was losing weight. It was unintentional weight loss. The owner wasn't feeding him any less. And so, yeah, it was definitely a bit of a surprise when we diagnosed him with just run-of-the-mill hyperthyroidism.
So what is your approach when you suspect hyperthyroidism? How are you approaching these diagnostically?
Yeah, and so I think in most cases, I try to think about the fact that total T4 is not a perfect test. In some healthy cats, total T4 concentrations can sort of creep outside of that reference interval. And even more importantly, in 10% of hyperthyroid cats, those total T4 concentrations can fall within the reference interval. And so I'm usually considering that if I'm seeing those results around that upper end of the reference interval on either side of it, I'm usually going to do a more advanced workup. Now, in most cases, it's relatively easy in that typically what we are recommending is that you repeat testing and in some cases perform a complete thyroid profile. And what we often do is we usually combine that. So we'll usually repeat thyroid testing, but we'll do it with a comprehensive thyroid profile that includes free T4 measurements and TSH measurements in addition to the standard total T4 measurements.
And I love that you said in some of these guys, the total T4 is falling within the reference range, because that kind of segues into my next question about age. I remember being taught, just all overall, that when a cat is older, keeping an eye on them when the total T4 is kind of in that upper end of the reference range, because it may technically fall within the normal range, but those guys actually may be hyperthyroidism. Does age play into our decisions on whether or not we recommend further testing?
Yeah, I think so. There's definitely evidence to suggest that older cats probably have lower thyroid hormone levels than younger cats. And so in the geriatric cat that I do see a thyroid hormone result that's in the upper end of that reference interval or right near, I certainly do have a greater index of suspicion that hyperthyroidism might be present. And so absolutely, I'm usually going to do a little bit more for that cat than I might for, an 8-year-old cat that doesn't have any other clinical signs. And certainly we can do other diagnostics. We can do thyroid scintigraphy studies where we actually measure uptake of an iodine isotope in the thyroid gland. But in the vast majority of cases, that's not needed. Usually just repeat testing with a really comprehensive thyroid profile will really provide clarification on the majority of cases.
Okay, I'm really happy to hear what you said about the repeat testing, because that is generally my approach. So I'm glad to hear that that's the right approach in these guys.
Yeah, absolutely.
Let's circle back to Agnes and Nigel. What was your approach with them? What did the testing show on them?
Yeah, so for Agnes, it kind of circles back to what I was just saying too, and that in her case, there were minimal clinical signs. There was also little urgency to obtain a diagnosis. She was doing really well clinically. It was sort of an incidental discovery. And so we simply waited and retested her a couple of months later, and we did do a complete thyroid profile. And as you can see, it's a more telling picture. All of her thyroid hormone concentrations are high. Her total T4, her free T4, her total T3, again, very mild, but convincingly high. And her thyroid stimulating hormone, or her TSH, is completely suppressed at 0. And so when you look at this profile, it's a really convincing picture for hyperthyroidism. And so we did reach a definitive diagnosis of hyperthyroidism in Agnes. Nigel was a little bit different. We did do a complete thyroid profile in him, but we did it right away because of the clinical picture. He was more severely affected. We didn't want to wait weeks to months to try to arrive at a diagnosis. And his thyroid profile is also really suggestive of hyperthyroidism as well. His total T4 and his free T4 are both very mildly increased. His total T3 was at the high end of normal, as you can see, and his TSH was also suppressed. But at the end of the day, those very mild increases in thyroid hormones didn't seem to correlate with the severity of his clinical picture. I mean, he had lost basically 30% of his body weight. And so we actually pursued a more aggressive workup in him. We ultimately did an ultrasound, GI endoscopy, and he was eventually diagnosed with small cell lymphoma affecting his GI tract. And so he did have hyperthyroidism, but probably a big picture of his clinical abnormalities were in fact the presence of a comorbid condition in that case.
What a great case. I mean, what a good reminder to make sure that we're correlating our lab results with clinical signs. I think think it would have been really easy to stop at the thyroid diagnosis and say, oh, that's why he's losing weight. But I think that case is such a good reminder to just dig a little bit deeper if the pieces don't quite fall into place the way they're supposed to.
Yeah, absolutely. I think in his case too, and another clue in the history was that his appetite wasn't always great, and it was actually a little bit decreased during some of these events. And so I think the classic hyperthyroid cat usually has a ravenous appetite. At the minimum, it's usually not decreased. So again, I think looking at that clinical signs, the fact that the severity of weight loss was pretty pronounced, and the thyroid hormones were so minimally increased, considering the possibility of a comorbid condition was really important in Nigel's case.
Absolutely. Absolutely. So talking about Agnes, who had all of her thyroid hormones elevated, what about treatment? What are our options for treatment in a hyperthyroid cat?
Yeah, so I think in general, there's 4 commonly used treatments. Methimazole administration, or Felimazole, is probably the most common that we see. We do see some people that want to pursue more definitive therapy, so either therapy with radioactive iodine or possibly a surgical thyroidectomy. And a few years ago, there was the release of the Hills-Whitey diet, which is an iodine-restricted diet. And so I think those are the 4 main options that we see. Now, for any individual cat, we try to tailor the treatment approach that's going to be most appropriate for that individual cat. And so we use all 4 of those in our practice. I would say that probably 99% of the cats that we manage are either going to be managed with Felimazole or radioactive iodine. It's really rare that we're reaching for those other treatment options.
So how are Agnes and Nigel doing now? How did you choose to manage them, and what was the outcome?
Yeah, so for Agnes, the owners were a bit older. They really expressed a strong desire not to administer any medications whatsoever. And so we ultimately elected to treat Agnes with radioactive iodine therapy. We treated her with a low dose, 2 millicuries of I-131. And you can see from her thyroid profile here is that her thyroid hormone values did normalize. And this profile was done about 3 to 4 months after treatment. And her T4, free T4, they're actually a little bit in the low normal range. Her TSH is sort of in the high normal range. So almost borderline hypothyroid, but overall clinically, she was doing really well and seemed to really do well with that treatment. Now, Nigel, on the other hand, he had a lot going on with his small cell lymphoma and his hyperthyroidism. And so we really didn't want to get into the route of going down the radioactive iodine treatment route at this point. So he was treated with Felimazole, 2.5 milligrams twice daily. He also received treatment for his small cell lymphoma. And you can see this is his thyroid profile 5 months in, at which time his GI disease was very well controlled. And his thyroid disease was also really well controlled too. His thyroid hormones are all sort of in that middle of the reference interval. And clinically, he was doing great at that point too. So both cats, 2 different treatments, both of them did very well with that.
Dr. Langlois, I just want to say thank you so much for joining me for this talk today. It's been such a great refresher on hyperthyroidism, and also just the importance of looking at the whole picture, treating the patient along with the lab results, not necessarily focusing strictly on one or the other. So thank you for being here and sharing these cases with us.
Oh, yeah, you're very welcome. Again, I'm happy to help. It's been great.
And thank you to DECRA for sponsoring this edition of Vet2Vet. We hope to see you back for the next in-depth discussion. And remember, if one animal is better off because of you today, it's a great day.